Patients frequently come in and they want to have everything done under local anesthesia. And is local anesthesia really better? Well, it depends on what you're calling better. In terms of risk profile, it could be better, it could be worse. In terms of patient comfort, it could be better, it could be worse. The idea of having local anesthesia is very attractive because you figure, well, I'm not being put to sleep, I don't have to have a tube, I don't go on a ventilator. And so all of that sounds like a great idea up until you're having a procedure and you begin feeling things, because local anesthesia is not perfect. And when you're fully awake under just local anesthesia, if it's a small area, it can be very well controlled. If it's a bigger area, like having liposuction done in a big, broad area, it might not be so comfortable, and you might feel some of those pokes and some of the things that are happening during surgery. In terms of safety, if you're doing big, broad areas and trying to do it under local anesthesia, there are toxic limits to lidocaine, or whatever the local anesthetic that's being used is. If you get close to the toxic limits, you may start experiencing some side effects. Some of them can be dangerous. You can actually trigger arrhythmias in your heart by having too much lidocaine. And these things can be life-threatening if they happen at a bad time or in a bad way. So local anesthesia can be better if you can avoid some of the possible complications of general anesthesia, but it's not always the best choice.